Hello everyone, so this is the sixth and the last part of the basic principles of screw fixation. The last part covers the plate designs. We have 1/3 tubular plates that are either 3/5 or 4/5. We have dynamic compression plates that are also either 3/5 for fibula or 4/5 for tibia. We have limited contact dynamic compression plates 3/5 and 4/5. We have reconstruction plates and we have other special plates. The 3/5 tubular, 1/3 tubular plates can take 3/5 cortical screws, 3/5 shaft screws, and 4/0 cancel screws, while the 4/5 1/3 tubular plates can take 4/5 cortical screw, 4/5 shaft screw, and 6.5 cancel screws, and the same for other plates as well. The 1/3 tubular plate is a very thick plate which is very advantageous in areas where you have a thin soft tissue coverage, but also it makes the plate weaker. However, the holes of the plate have a collar that is pretty strong, and that prevents the screw from penetrating and breaking or cracking the plate itself. The holes are oval in shape, which allows you to do a compression again by doing your drilling away from the fracture site. The dynamic compression plates are designed for compression, and again we cover this part. The portion of the hole is actually a part of an inclined or angled cylinder, and you drill away from the fracture site. The dynamic compression plates, they have different orientation of the rounded portion of the plate holes. Proximal to the fracture site, they will be in this direction. Distal to the fracture site, they will be in the opposite direction. And again, you drill away from the fracture, you cause movement of the plate away from the fracture. In this way, you actually compress the fracture site. Dynamic compression plates also allow you to move approximately 7 degrees in the transverse direction and 25 degrees in the longitudinal direction, so you're able to make some adjustment if you need to do a compression across the fracture site by a screw that is also inserted through the plate. You have different types of drill guides. You have the green, you have the yellow, and you have the standard or the universal drill guides. The green one is only 0.1 millimeter off the center, and this one you use it for neutralization plate. You have the yellow one where the hole of the within the drill guide is 1 millimeter off the center, and that allows you to do compression. And finally, you have the universal drill guide that is dead center, and you use that for buttress plating. There's also the limited contact dynamic compression plates. As you can see here, this is my dynamic compression plate. This is the limited contact dynamic compression plate. On the plantar aspect of the limited contact plate, there are areas that are hollow, and also if you compare the dorsal and the plantar surfaces of the limited contact, it's smaller on the plantar than the dorsal. However, in the dynamic compression plate, the regular one, it is equal in both plantar and dorsal. So advantages of this are two. First one is that when you try to remove the limited contact dynamic compression plate, it's easier to remove because the plantar surface is smaller than the dorsal surface. And also these areas that are hollow on the plantar aspect allows for as little as possible of contact with the bone surface and compression on the periosteum. So again, it's very important for maintaining blood supply to the bone and enhancing the healing process of the bone. In addition to that, when you try to bend both plates, this is my dynamic compression plate, this is my limited contact dynamic compression plate, the stiffness and the holes are distributed equally in the limited contact dynamic compression plate, which allows you to bend the plate without kinking. As you can see here, there are some kinks on the dynamic compression plate, but not on the limited contact dynamic compression plate. Again, here are the advantages of the limited contact. You have decreased damage to the periosteum. You have capability to gain compression in either directions with any hole. You have greater screw angulation due to undercut surface of the plate. You have better contouring and it's easier to remove the limited contact dynamic compression plates. They also have their own drill guides, which is eccentric if you do not compress on the drill guide, but if with some pressure, this central hole here moves and becomes exactly in the center. So you can use eccentric position or neutral position by only using one drill guide. The reconstruction plates are capable of being contoured in all three planes. This way you can utilize them for complex geometry of fractures, or if you're doing a complex osteotomy as well, or for any deformity correction. We have locking plates as well, which are very good in osteopenic bones because, again, they do not require bone to plate compression. They do not require good bite for a stable fixation. At the same time, since the screw is being locked within the plate, there's less chance that the screw will back out from its position in osteopenic bones. We have also the locking compression plates. In these ones, they have a big hole. Part of it can accept a non-locking plate that you can utilize for compression, while it has also a locking portion that you can utilize for a locking screw. So finally, we have the variable angle locking compression plates. So most of the plates that we've spoken about before are fixed angle. These ones are variable angle, which means that you're capable of moving the screw 15 degrees in each direction, so a total of 30 degrees. This again gives you the flexibility to insert your screw in a wide area according to the scenario that you're dealing with. And here's another example. Finally, thank you so much for watching these lectures, and if you have any questions, you can also leave comments and I will try to get back to you as soon as possible.